Now, acne and rosacea are the most common skin conditions in Ireland and a lot of other Celtic nations. A lot of people suffer from them, not only physically, the physical side, but there's also the emotional side. Joining us now is one of the country's leading dermatologists, Dr. Rosemary Coleman. Hello.
Hello, Maura.
How are you?
Very well, thank you.
Great. Now, Rosemary, rosacea and acne. Let's talk about rosacea first and explain to everybody what it is. We'll just show a photograph maybe for us to set it up, and you can explain to us. So it's that redness that we often see, rosiness or ruddiness.
Yes, rosacea is very common in Ireland, and in fact, if you're on the bus home from work tonight, you're going to see it, if you look for it. It usually appears as some redness, spots, lumps and bumps around the cheek and nose area, although it can often extend into the forehead and occur anywhere in the body, actually.
How does it happen, or why do we get this?
Well, it's called the curse of the Celts.
That's right.
So genetically, we're very predisposed, and it's very common in both women and men. And it's one of those things that often runs in families, and it appears out of the blue for no reason, but people will often tell you that it's made worse by certain factors, such as eating spicy foods, hot drinks, or alcohol. Okay,
now we have a selection of food here today. All of these are not good for rosacea. What is the worst?
Well, they're not all bad either, but the red wine is probably something that a lot of people complain about, because when people drink wine, as you know, when you're in the pub, you'll often see a lot of red faces and a lot of flushing. Anything that opens up the blood vessels and causes vasodilation can aggravate skin conditions, in particular rosacea. So they'll often find they're really quite irritated and flared up the next day.
All right, we do have some people getting in touch with us about rosacea. What is the best brand of cleanser, moisturiser, foundation for rosacea? Redness always breaks through as the day goes on. That's from Marie. And I'm 44, have acne and rosacea. A main problem is breakout along the nose. Could you give me advice about this and what face creams? Should you use something that is very mild on your face without any perfume in it?
Yes. If I'm allowed to mention brands?
Yeah, mention a couple of brands, yeah.
I often recommend the range La Roche-Posay, Avène or Rock, because I think they're really good products. They all have specific ranges for red, irritated skin. They contain ingredients that won't irritate the skin and that will actually calm it down, like feverfew and chamomile, etc. And they genuinely work.
And they're very good priced as well, aren't they?
They're very well priced. They're very easy to get. They also specifically not only calm down, but they won't have perfumes that will irritate the skin.
Very good. Okay, so you've got Avena, Vichy and La Roche-Posay out there of yours. Let's take a look at rosacea being treated and how you treat it.
Okay. Well, the first thing is really what you're saying. We remove any irritating factors if we can find one. Make sure that people are using a proper skincare regimen. In particular, I'm a big advocate for using water with a face cloth to wash off the cleanser. And a lot of patients who don't, get a build-up of creams on their skin, and they get overgrowth of another little fella called Demodex, which is a mite that can lead on to rosacea. So they go around in circles if they're not cleaning the face properly.
Okay, so cleanse properly. What about laser treatment?
Well, the best treatment will usually start with medical therapies. We'd prescribe topical creams, and we'd prescribe antibiotics or Roaccutane for rosacea. And then laser therapy would be ideal for the patient you saw in your first photo, where the main problem is redness and flushing and broken blood vessels.
Okay. I think we actually have that after photo. So let's show the before photo again to remind everyone of that photo, and then we'll show the after photo.
Tablets and creams won't get rid of her broken blood vessels. She'll have to have laser.
Have to have laser for red broken. Okay, so this is the before photo that we saw. So a lot of broken veins there. And there is after. Now, that's been treated with laser as well, I presume, Rosemary, has it?
That's intense pulse light therapy.
Yeah, I thought so, yeah. So that closes the capillaries and the vessels. Yes. Okay, quickly, let's talk about acne. Acne is a different thing, because it's in spots. And can acne happen at any stage of your life?
Yeah, acne can occur at any time from infant to old age. And in fact, one of the most common ages I treat now would be women in their 30s, 40s and 50s who say, this can't be acne because I'm not a teenager. And again, it's a matter of isolating the trigger factors. This is where I think the food is very relevant. I coined a term called acne latte. And a lot of women...
so dairy.
Dairy is full of hormones. So dairy comes from breastfeeding cows. And the breast milk is full of hormones, and they're androgenic. There's a very good website, acnemilk.com, which explains why dairy, milk and cheese can really aggravate acne from teenagers onwards.
So cut out dairy?
Well, certainly cut out the cafe lattes to start with, cut out the glasses of milk. I find a little bit of milk and cereal people can tolerate.
Can I ask you, is there any difference in full-fat milk and slimline milk?
No, they both have the hormones.
Okay, so maybe soya milk, would that be okay?
Perfect.
Okay, soy milk. What else here would be irritants for acne?
Cheese.
Cheese, of course.
During the fermentation process, the hormones are actually concentrated in the cheese. Chocolate, you've got a dark chocolate sample there, which I like because it's reduced sugar and there isn't dairy in it. So if you like your chocolate, switch to dairy or switch to dark. And people often think that the more fruit they eat, the better. But a lot of fruit, particularly the high glycemic index, like grapes and berries,
Bananas.
Banana is low glycemic, that's better fruit, but some of the others can really aggravate acne. So people think, well, I'll switch from the milk to the fruit drinks, and they can make things worse because sugar is very inflammatory.
Okay, acne treatment, would it be laser again?
First line, drugs, go to your doctor, get topical therapies, get medicines, and then we use, lasers are very much a secondary line for acne. The drugs are much better. Unpopular sounding drugs like Roaccutane are magic for acne, and they prevent the scarring.
Very good. Okay, Rosemary, thank you very much. Of course, we never have enough time to talk about a subject like that. You'll have to come back to us to talk about this more in-depthly again, but we will put all the information about these skin conditions and the treatments available, Rosemary's treatments, on our website on the Airtel page. That is 340.